So Dr. Vincent, tell us a little bit about yourself, including your career, your current role, and where your practice is located.
Yeah, so I'm an internist, which means I'm board certified in internal medicine. I am originally from Mexico City. That's where I studied medical school at Universidad Autónoma Metropolitana, Autonomous Metropolitan University. And then later I completed my residency program at the Cambridge Hospital, Cambridge Health Alliance. I am from Mexico City. My mom is from Mexico and my father is from Haiti. I am therefore privileged to speak 4 languages. I speak English, Spanish, French, and Haitian Creole. And this has given me the opportunity to really teach to a big multicultural population. I practice internal medicine in the Hingham Shipyard, one of the Brigham and Women's primary care locations.
So today we're going to talk about aging. And I'd really want to know just exactly what does that mean in terms of the process of aging, when does it begin, and what are some of the important areas that we need to be aware of? So where would you like to start?
Well, I would like to start by explaining the process of aging itself. So aging is a well-known process or pathophysiologic event by which our different organ systems or different parts of our body go through different changes. And these are known and predictable changes that now we have been able to determine. The funny part is that although these are predictable, they are not the same for every individual. There's actually a very interesting Danish study that shows, this was done on twins, and that shows that what determines aging or healthy aging or longevity, it's only 25% of our make, means 25% DNA, and 50% is related to the choices we make to our environment. And I think this having this knowledge is very important, especially in medicine, because it helps us determine that actually there's a lot in our power to determine how healthy we age and how much those changes are going to affect us through life.
That's fascinating. So when we look at that process, and if in fact 50% is a reflection of choices we make, does that include our environment as an example?
Mm-hmm. So yes, so let's try to think about the different organ systems. For example, if we think about the cardiovascular system, I think that's one of the most important and much better studies. Right now, probably 75% of the population who's older than 65 has some sort of cardiovascular disease. And what happens as we age is the muscle, we lose a little bit of that muscle, the muscle of the heart. The heart is able to pump less, but also we lose what's called the compliance or elasticity of the blood vessels. And so what happens is that we develop high blood pressure because there's less compliance as the blood goes through our, through our arteries, through our main blood vessels. And the heart, if we haven't exercised as we were young, has less ability to push against that, that pressure that is increased. But also, if our diets, let's say, were high in cholesterol, that cholesterol unfortunately accumulates inside of those blood vessels. And as we know, the typical American diet, unfortunately, is high in fat and also causes high blood pressure and can clog those blood vessels. So this is how you develop the multiple cardiovascular disease that we're well aware of, hypertension or diabetes or heart disease. And so those are quite preventable with exercise. If we exercise, and this is since we're very young, since we're children, we develop a very, I guess, muscular heart, a very strong heart, but also we develop a very good cardiovascular system. And our body develops the ability to burn this fat as opposed to accumulate it into the fatty tissue in blood vessels. And so we can predict developing these cardiovascular diseases. It's just really depending on our choices. It's the same for the respiratory system. So as we get older, starting at 30, as young as 30, we start losing some of our respiratory compliance mass. The same thing related to muscle. We have more what's called the dead space, which is more an area of the lung where there's no exchange in oxygen. And so our bodies become more dependent on being able to take those deep breaths. In our elderly population, we can see that when they're lying down, they've developed like a phenomenon called atelectasis, which is really just part of the lung that is just non-functioning. And this can just improve just by standing up and walking around and taking deep breaths. So again, it's in our choices. It may be part of DNA, but also in our choices to kind of improve the cardiovascular system and respiratory system. If I were to think about another very important organ system, which is the brain, I think everybody wants to know, so what happens to your brain as you age? So interesting enough, as we age, we do lose neurons, we do lose some neural connections, but the reality is that new ones are formed all the time. So what does that mean? We do have the ability way into our 70s and 80s to still learn new things. It does get a little bit more difficult. So let's say, for example, what's called the executive function, the problem solving, the ability to focus, those get a little bit more difficult with time. We have a little bit more trouble doing multiple things at the same time, but in the right setting, we can still learn new things and new synapses will form. And on the other hand, the things that we have learned that we specialized in, let's say we are musicians, professors, writers, those actually continue to improve as we age. So what I'm saying is that the 70-year-old professor, musician can be much, much better than the 20-year-old musician, professor. And we sometimes underestimate the power of experience. And this is very important because still, as we get older, we can learn a lot from our elderly, I guess, grandparents, parents, etc. So it is important to know that it is always good to continue exercising the brain. There's multiple studies that have shown that actually Alzheimer's disease can be prevented, maybe not prevented, maybe more postponed if we continue to exercise our brains. People who have studied have less of a chance of developing Alzheimer's as they get older.
So Dr. Vincent, let's talk a little bit more about brain health and what are some of the things we can do at home. Oftentimes you'll see these advertisements on television and on the internet about the various games, electronic games that one can play, like Words with Friends and other types of tactile interactive puzzle games that you could have on your cell phone. What are your thoughts about those and how beneficial are they?
So basically anything that makes us be stimulated, that's basically what this means. It doesn't have to be one single thing. It has to be something that provides us pleasure and makes us feel that we are important. And so whether it's reading, whether it's playing with games, playing cards, whether it's a grandparent watching their grandchildren, that involves a lot of multitasking and a lot of problem solving at the same time, whether it is being a musician and being able to play an instrument and composing new music. So all those things will work different areas of our brain. So we have an incredible amount of choices of things we can do. It's just about remaining engaged and active.
Now let's move to other parts of the body with respect to aging. And there's one area that you speak on that I'd like you to explore a little bit more in depth is the circadian rhythm, particularly in light of the fact that we're in that seasonal change now where we turn our clocks back.
So yes, as we age, the circadian rhythm affects us a little bit more. We lose our ability to have a good homeostasis. And what that means is, for example, changes in time, changes in daylight will affect us more strongly. Our sleep pattern becomes much, much lighter as we age. And this still can be preserved with good exercise. So for example, let's say if you're the typical person who wakes up at 7, goes to work at 9, is done at 5, and then back in bed at 9. It doesn't happen to everybody, but let's say if you do this on a regular basis, the most important thing during that journey is try to make sure at some point during the day, especially with the time changes, is that you get some daylight exposure. So just go outside for a little bit, have the windows open, make sure you get some light, some noise during the day. It is also important to increase our body temperatures during the day. So exercise early in the morning or in the middle of the day, it's very important. A lot of people don't have time to do the exercise in the morning and do the exercise later in the evening. And while this is good if you're able to sleep, it is sometimes difficult to bring down your temperature at the end of the day when you do the exercise right before bedtime. So those are little things that you have to be aware of that can affect our circadian rhythm. As you get older into your 80s and your 90s, to prevent what's called delirium, which is basically being confused with the day and night, it is very important that anyone taking care of an elderly parent knows that for this elderly person, it is important for them to have a routine and also get exposed to daylight, to noises during the day, and then keep a very quiet and cool environment at night. And this little by little will regulate their circadian rhythm and help them.
That's good information to know.
Mm-hmm.
Let's talk a little bit about the muscular system.
Mm-hmm.
Particularly, we talk about muscle memory, and when we don't use certain parts of our body, the body begins to lose its density of mass, if you will, and yet when you resume exercise, there's this muscle memory that kicks in. Tell us a little bit more about that.
So yes, as I mentioned earlier, when I was talking about the cardiovascular system, the muscular system also obviously little by little atrophies. You start losing muscle mass, and this is unfortunately quite significant, but can be delayed with good exercise. And when people ask me about what's the best exercise I should be doing, well, it is a combination of multiple things. Number one, what we call the cardio exercise. So that's just running, swimming, biking. This is the exercise that increases your heart rate, and this is the one that will provide a better cardiovascular life. But at the same time, strength training and balance are very essential as we get older. They're not only essential for our muscles, but they are also essential for our bones. We do lose bone density as we get older. It means the bones get a little bit more brittle, more frail, but this can be preserved if we try to do exercise. And we're talking exercise at a very young age. Again, when we're just very young adults, starting a good exercise routine, good balance, this can continue as we go on. Now, I'm not trying to say that when we're older, if we have never exercised, we cannot go back to exercising. There's multiple studies that have shown that just starting a good exercise routine in the elderly, just for 6 months, has a significant impact, not only in their mental well-being, but also in their survival.
That's a good point, because we hear talk of the core strength. Mm-hmm. What is your core? And that if you can maintain strength in your core, you minimize the risk of falls, particularly if you live at home alone and you're, into your late 60s, early 70s, where that core strength begins to weaken. Can you tell us a little bit more about that?
Yeah, so Joe, you just mentioned a very important point, and this is especially important as we get into our 80s and our 90s. It's the core strength. And it is a combination of balance and strength. So basically, the core strength refers to the strength of the muscles in our trunk area. And it is, while we lose this by just doing things like just sitting all day and lying in bed all day, we can definitely gain this back by trying to do very simple exercises. A good type of exercise is Tai Chi, where you do just very slow motions, and you can eventually gain that balance back. It is a very big, having good balance and good strength are very big predictors of longevity. And they also help us to keep our independence. You'll see that as we get older, if we're unable to walk around, even if it's with a walker, we become more dependent on family member or maybe in nursing homes. And this, no matter what, eventually affects us, not only physically, but mentally. And it does contribute, unfortunately, to decreasing our life expectancies.
Let's talk about one of the largest organs on our body, our skin. Skin health and how important that is as it relates to the aging process.
So the skin, like all the organs, gets thinner. And as it gets thinner, not only loses the body fat that keeps us warm, but it also loses sweat glands, which keep us cool. So as we age, we lose that ability to, be warm when it's cold and and cool down when it's warm outside. If in addition to that, we are dehydrated or we don't use the proper layers, we become much more susceptible to big changes in temperature. So this is just something we have to be aware of. Good hydration is number one, and try to keep a healthy skin, and also a good sun protection. So when we are outside in the sun, using sunblocks, sunscreen, or just using a hat, using good protection will help us to keep a healthier, younger skin.
And does it vary by gender and race and ethnicity, depending on the melanin, for example, in the skin?
Yeah, there's variations. The darker the skin, the more there is a little bit of an element of sun protection, but it is not as high as we think it is. And so no matter what your skin pigment is, it is very important to have some sort of sun protection if the intent is to be outside all day long. 20 minutes of sun exposure on the arms and the limbs, as long as we don't have a family history of skin cancer, are healthy. We do need the sun for vitamin D production, but other than that, all of us kind of have to be a little bit careful of not staying in the direct sun for like hours and hours at a time. So the traditional sun tanning without sunscreen is not a very healthy habit. It eventually dries out our skin and ages our skin.
Let's talk about life expectancy, and is it growing? And if so, by how much each decade? And what do you think are the factors that are influencing this increase?
So life expectancy here in the United States is definitely increasing. We're getting to a point where about 20% of the population is older than 65. And what does this mean? That means that little by little, we're seeing more people who are 65 years and older, as opposed to people who are 15 and younger. And so we're definitely an aging country. And this is mostly because of the advances of science, the knowledge of what keeps us healthy, big improvement in cardiovascular disease protection, in hypertension, diabetes management, in healthy eating. And so that's one of the things that have led us to have longer life expectancies. Also, now we're much more aware of, as we get older in life, that it is important to keep our elderly population engaged. So there's much more senior centers, volunteer centers where people can continue after retirement to continue be engaged. And those are things also that contribute to improving our life expectancies.
And some things that we can do to increase our longevity. What are your thoughts?
Yes. So as we were talking about the different organ systems, it always comes back to the same, right? Number one, good exercise. If we have a good combination of cardio exercise, strength training, and balance, this is going to improve our physical independence of being able to do things by ourselves. If we're able to keep ourselves mentally sharp by continuing to study, by continuing to be engaged in the community, this is also going to help us with independence. And another one that I mentioned a little bit is healthy eating. There's no one specific diet that is the best diet, but the one that is the best is the one that's the most natural. So try to avoid processed food, fatty foods. That's what we know works. There are actually studies that show that every pound extra that you gain from the moment you're 18 will determine your life expectancy. And again, this is not bad news as we get older. If we are overweight, it doesn't mean that your life expectancy is doomed. All it means is you have to just kind of exercise and try to lose some weight. There's a study that shows that if you're able to lose 5% of that extra weight that you have, you can significantly improve your life expectancy. So what does that mean? Let's say you are 200 pounds. All you have to do really is to lose 10 pounds. And with 10 pounds, you're going to cause a significant improvement in your cholesterol numbers, in your blood pressure. And if you have diabetes, your numbers are going to go down, and you are going to add significant number of years, of healthy years, to your life.
Dr. Vincent, as a primary care doctor, what are some of the things that you like to do in terms of treating and addressing the needs of your patients, particularly with respect to aging?
Well, I usually enjoy doing all the aspects of internal medicine, from women's health to also all the chronic diseases that affect aging, from diabetes, COPD, high blood pressure, and including obesity. I really love sitting down with the patient and explaining the disease process, the pathophysiology, making them an expert in their own illness, sitting down with them and explaining the different medications and medication interactions and why were those medications chosen specifically for them and to treat this specific illness. And it's so rewarding to see when a patient understands their own illness. It promotes them to be able to take their medication and accept that this is the right medication for them, but it also helps them to make the right choices for themselves. This happens over and over again. I also love to sit down and being able to take medications off patients. As you get older, your liver and your kidneys don't work as well as they used to before. And again, this changes person to person, but very importantly, some medications that work very well for you, they can be blood pressure medication, they can be diabetes medications. You don't need as high of a dose as you get older. We have to remember people sometimes lose weight as they get older, they lose body mass index, they lose muscle. And so being able to review the medications and as you get older, actually less is better. Being able to take those medications, to me, it's very rewarding. The patients are very happy about that. And also being part of this, making this decision. Same for preventive diseases like cervical cancer, breast cancer, colon cancer. I usually like to present the medical evidence and so that they can decide, okay, I think I want to do a stool test instead of doing a colonoscopy. You know, I think I have a family history of colon cancer, so I think the colonoscopy is the right test for me, etc.
You know, you just reminded me of something that we used to do with our mom when she was still with us, when we would take her to her regular doctor's visits. We'd gather up all of her medications, put them in the plastic bag and bring it to the doctor and say, okay, which ones are still good to go and which ones do you need to toss out or modify? So your point is well taken there. And that's great advice, I think, for many of us who still have our parents. And we as the adult children are helping, guiding, supporting that care for our older parents, to be mindful of bringing all those medications to the doctor.
It's very important. Mm-hmm. Especially as our brain age, sometimes we might confuse some medications. Sometimes some medications just stay there. So bringing your medications to your doctor is very important, and then always reassessing as you come in and we sit down together and see what is necessary and what is not. It makes a big difference in the patient's health.
Dr. Vincent, final thoughts that you'd like to share with us?
So as we go back to the longevity and healthy aging, I can summarize this as just a few words. Number one, healthy exercise. And this is a combination of three things: cardio, strength training, and balance. Number two, healthy eating. Which one is the right diet? The one that has the more natural products, less fatty foods, less processed carbs, and is able to keep us in a healthier body mass index. And number three, exercising our brains, not only by learning new things, by teaching what we know. We are always experts in something, and we can always teach it and teach it better than someone who's younger than us. And also being engaged in the community. We are social individuals by nature. And so whether it's through the internet in this new world, or whether it is talking on the phone, talking with family, staying engaged in the community is also very important to promote our longevity.
Dr. Carole Vincent, primary care doctor, we thank you so much for visiting with us. Continue to stay safe and healthy, and we look forward to visiting with you again in the future.
Thank you, Joe. It was a pleasure to meet you.